everyone, welcome back to ADC Aspirants. I'm Dr. Henna. Are you someone preparing for the final stage of the Australian Dental Council examination and wondering how to crack the OSCE component? Then you've landed at the right video. In this video, I'll walk you through everything about OSCEs, what you will be facing in the examination, how to structure your answers, and most importantly, how to maximize your chances of success with the help of your own practice. Let's get right into it. So what does OSCE stand for? OSCE stands for Objective Structured Clinical Examination, and it's one of the most important components of the final stages of the ADC exams. In this part of the exam, your clinical reasoning, your effective communication, and professionalism, along with a lot of other aspects, are tested. It's less about your hand skills. In fact, it's more about how you will problem solve in the real world clinical scenarios. Now, there are usually 6 rooms for OSCEs. 2 of them are for the cluster of information gathering. The other 2 are for the cluster of diagnosis and management. And the last one is for the cluster of clinical treatment and evaluation. And you're given 10 minutes. The 10 minutes timer is for you to complete talking about the scenario, answer the questions that are thrown your way, and to cater to that particular cluster. You are marked on a lot of aspects. It could be effective communication. It could also be whether you have answered the whole problem around the scenario or not. And it could also be whether you have tick marked all the boxes that are needed in that particular scenario. If any of these are not covered, it may pose to be a problem in your results. Now let's dive deep into each of these clusters. And before I begin, let me tell you, I will not be talking about each and every scenario because we are not aware of what they exactly are looking for, but we can certainly see and learn from what we do on a day-to-day basis at our dental clinics. Let's talk about the first cluster, which is the information gathering cluster. Now, as the name suggests, what does information gathering actually mean? When a patient comes to you at your clinic, what is the first thing do you do? Do you start off with taking x-rays, or do you start off with, making the patient sit on the chair in clinical examination? The first thing that you do is history taking, information gathering, as the name clearly suggests. You have to ask all the aspects of the history which are not only related to the chief complaint, but as per the patient per se. So you cannot be ruling out just one condition or the other condition based on 1 or 2 answers. Information gathering has to be a wholesome procedure where you talk about the medical history, you talk about the chief complaints, you talk about the investigations in no particular order, but of course you have to cover all of these aspects. Now let's see a very, very basic scenario. For example, a patient walks into your clinic and he says that I've got a very bad pain in my lower right molar region. The patient of course doesn't know it's a molar, but he says I've got a bad pain or discomfort in my lower right back region and it's been there since a month. So what do I do? Now, before you jump into any conclusion, it's all about asking about the various aspects of discomfort that may have, caused him this problem. What is the pain related history? How long has it lasted for? What has he taken to relieve the pain? Or has he taken anything or not? I'm just going to be talking about a few aspects. Of course, there's a whole lot more which is involved in history taking. But if you don't cover these aspects and if you jump directly to your diagnosis or your investigations, you're in trouble. Information gathering has to be a wholesome because that's the first time you're seeing the patient, you're talking about their problems, and you're trying to arrive at a diagnosis. And before you arrive at a definitive diagnosis, you have to formulate your provisional diagnosis, which will help you conclude the scenario. Let's talk a bit about what are the most common mistakes some candidates or some overseas dentists do in this particular cluster. Number 1 is what I've seen most commonly, not taking all aspects of your history. You may take your pain history, you may take your chief complaints, you may talk about your presenting complaint, but what about the medical history? What about the medications the patient may be on? What about, any other history which is relevant? So if it's an orthodontic scenario where you're seeing a child, have you asked the child about, or the parent about, all the milestones which have been achieved or not? If you are talking about a gum condition, or if you're seeing a patient who has periodontitis, maybe you haven't arrived at a conclusion yet, but have you asked, everything about bleeding, sensitivity, and, wobbly teeth, etc., etc. So completing your history in a particular format is very important, and in our OSCE coaching classes, that's what we help you with. We give you a format which you can never miss out, mnemonics or abbreviations which stay in your head, and they help you formulate your correct questions in this particular cluster. Another mistake that I've seen commonly people make is arriving at your diagnosis without taking appropriate history. Everything boils down to correct history, doesn't it? Well, that's how it is. So what I've seen is that many candidates end up talking about the diagnosis first, and then they, formulate their pathophysiology and they start correlating the risk factors. How do you know what the patient is suffering from unless you have actually interrogated every part of the history taking? So if you're one of them, stop doing that. One tip or one advice that I want to give all the candidates appearing for OSCEs, which is common for all the clusters, is never worry about the time too much. I know it's the first thing that, sets in our mind the moment we see a timer ticking. But that is not what the entire essence of OSCEs is all about. You have to manage your time, but you've got to be more careful about what you speak and how you speak that particular aspect in your OSCEs. So don't worry about that timer ticking, rather worry more about how and when, and are you answering the questions which are thrown at your way, or are you dodging them just because you're scared of the time? Let's come to the other aspect of, or the other cluster of the OSCEs, which is diagnosis and management. As the name clearly suggests, diagnosis is that you have been given a scenario and you have to arrive at a diagnosis. Maybe it's already been given to you. Now you've got to effectively manage. I talk about this a lot in my part 1 classes or the theory classes as well. Managing a patient doesn't necessarily mean that you're getting him out of the current condition and forgetting about the patient as a whole. You have to manage the conditions. How? Let me give you a few examples. If your patient ends up with cracks on their teeth, they've got failed fillings or failed amalgam restorations, you will definitely try and restore them. You will talk about the options that your patients have. But also managing means that you've got to get to the solution of the problem. What is happening behind the scenes? Why are there cracks? What are the habits the patient has? What can you do to prevent that in the future? That is effective management, or, managing the patient as a whole. Another thing that I want you to know is never forget to diagnose or give the correct diagnosis in this cluster. Sometimes it is expected from you to say the diagnosis even if it's given on the screen. You cannot just overlook the fact that a lot of information is there and you're just talking some bits and aspects of that information and not talking about the others. For example, if on the screen it's written that you've done a cold test on a tooth and the tooth hasn't responded and the gums are absolutely normal, you have to tell the patient, this is my finding, and based on this, I give you my diagnosis. It's important to correlate whatever information is on the screen and give it to the patient in the most layman language possible, because remember, they're posing to be real patients and not doctors out there. The last and the most important, actually they're all important, the cluster that I'm going to talk about in the end is clinical treatment and evaluation. So you've done your history taking, or you've arrived at your diagnosis. You have done your diagnosis management planning as well. What are you doing today to treat the patient? If your patient is in severe pain, or they've got bleeding gums, or a very wobbly tooth, or if they got some other problem, you have to talk about how you are going to get the patient out of that problem today, even if it is just providing pain relief through medications. That aspect is also a part of your clinical treatment and evaluation. Another important thing people forget is, when are you calling the patient back? Is there any review? We all know that dentistry most of the times for many patients can be symptomatic driven, isn't it? They come to you when they have problems, and they don't come to you when they don't have problems. So reminding the patients about reviewing this condition and also coming back for follow-ups and regular checkups is extremely important. So clinical treatment evaluation also deals with the fact whether you are the one who's going to be the provider for that particular condition, or are you referring the patient somewhere else. It's a bit overwhelming, I know, but with the correct kind of guidance, I'm sure you can achieve that level of accuracy which is needed to pass the OSCEs. Now, the last aspect, this is not a different cluster at all, mind you. This is something that is judged and you're basically marked for this in each and every room of OSCEs, and that is your effective communication. I know many of us fear this word a lot. How do they want us to talk? What is it that is expected from me to deliver my communication effectively? Let me tell you a few examples. Number one, people often think effective communication is only about knowing the language, just talking in fluent English, and that's it. It's not that. If you are somebody who struggles with English and English is not your first language, don't you worry. You're not alone. There have been many candidates in the past and even now who don't have English as their first language, but how they utilize this to their advantage is they speak in slow and clear words. OSCEs is not about using fancy languages and fluent English and going with the flow. It's all about delivering information at a slow, correct pace, just like how I am talking to you right now. Use small words, small sentences, but they have to be impactful. One way to explain this communication is the following example that I'm going to give you. I'll talk about two ways that candidates use to deliver information to the patient. So let's talk about the first one. Let's take an example of a periodontitis patient. So let's take an example where you have a patient, let's say Mr. Smith, who is a 65-year-old man, and you have given a diagnosis of generalized, moderate to severe periodontitis to Mr. Smith. And now you're trying to explain this to him. The first way some of the candidates, what they say is, Mr. Smith, when I was doing my investigations, I saw that you've got grade 3 mobile teeth at the back of your mouth, which are your molars essentially. Now, why that has happened is because you have deep pockets around your teeth, which have led to the destruction of the alveolar bone around that area, leading to infection of the gingiva, and that condition in our terms is called as generalized severe, moderate to severe periodontitis, because it involves more than 30% of your teeth. Now, Mr. Smith might give you these expressions as if he totally understands what you've said, but deep down he has no clue what you just told him, because your explanation was all about jargons, gingiva, alveolar bone, periodontitis, pockets. He has no clue what these mean. So the second type of candidate, which everyone should aim to be, how will they explain this condition? Let's look at that. So Mr. Smith, I've completed the investigations and I've done my findings, which I would like to talk to you about. What I noticed was that you've got some wobbly teeth in the backside of your teeth, both in the upper and the lower jaws. Why that could have happened is because you have a lot of space between your teeth and your gums. Now, what that essentially does is harbors more germs and microorganisms, which eventually leads to more damage of the tooth supporting structures and, most importantly, the gums in that area or the bone around that area. Now, this has led to an infection of the gums, and in our dental terms, this entire condition is called as generalized moderate to severe periodontitis, or in simple terms, it is basically infection of the gums. Now, imagine if you were a patient, what kind of explanation would you have liked? The second one, right? I know. So try and be a very, very layman-ish kind of a dentist who uses the most easiest kind of language to explain things to their patients. Similar to this, there are many other conditions like dental caries or cracks or vertical root fractures or stages of periodontitis, etc., which you're supposed to be explaining. And I know it gets very overwhelming to think about how do we best explain this to our patients for the OSCEs or even for the real life, right? So in our OSCE coaching, what we do is we provide you with all of this information in easy languages. All you've got to do is just put on your headphones, listen to it over and over again, practice it, and deliver it on the day of your exam. This now brings me to one of the most important aspects of the OSCEs, practice. How do you practice for the exam? Let me talk about my personal experience. In my attempt for the examinations, I definitely practiced with my own self. I practiced with my husband. I practiced with my colleagues. But what really helped me build my confidence over a period of time was looking and standing in front of a mirror and just talking to the mirror and explaining what I just explained to my colleagues or my friends, the same thing over and over again in front of the mirror. This exercise can build enough confidence in you to answer in the examination. I always tell my candidates, if the explanation that you're giving is easy for you to understand, it is going to be easy for the patient to understand. But if you think you yourself are struggling for words, you are not able to, say it in clear ways, or you're fumbling over and over again, imagine the plight of the patient. They have to be able to understand the information that you're giving with the right kind of knowledge that you want to give them. So for that, practicing in front of the mirror is my highly recommended advice to all of you. I may not talk about this enough, but I will talk about this in today's video. Empathy. I have been practicing some OSCEs with a lot of candidates, and I see sometimes I act and I try to be a patient in pain, and I come to the clinic saying, I'm in so much pain, I haven't slept all night. And the doctor or the candidate who's practicing with me completely overlooks the fact that I'm in pain and says, okay, could you please sit down? Tell me, when did the pain start? Or have you taken anything for the pain? Or could you tell me a bit more about that? Or could you just talk about when was the last episode? Let me tell you, yes, these are important questions, but what is most important is empathy. You have to be a bit empathetic, even if you have to act it out and you have no ounce of empathy left in you. You have to be a good actor. Tell the patient that you are sorry the patient has had so much of discomfort. Because honestly, you are the healthcare provider in this situation, and they've come to you with expectations, with hope that you can bring them out of this pain or this condition. So the correct way to deal with that is, I'm sorry, Mr. Smith, you've been going through this discomfort. Have you taken anything for pain? Do you want me to give you a pain relief medication that we have here? Something of this sort, and at least you would have tick marked that empathy for sure. In the end, before I tell you some top tips for OSCE success, I want to talk to you about what and how we help our candidates. We have OSCE sessions in ADC aspirants where we make you practice around 40 to 50 scenarios individually without a lot of other involvement of other people. So you and I or our mentors can get to know each other one-on-one. Because I believe just presenting 4 to 5 cases is not enough for you to master this. Number one, it's also about practicing and practicing and practicing more. You have to give yourself timed mocks which will help you better, make your time management better, make your communication better, and just work on your weaknesses a lot more. The other thing that we usually do is we give you explanations. So we have all of the cases that we usually discuss in our OSCEs subject-wise. So if there are around 10 or 12 perio cases, we give you the recordings of those that you can hear anytime at your convenience. So if there's anything related to caries, we give you that folder separately. So we don't want you to think that it's just about mastering 46 cases or 48 cases. It's about mastering the skills of talking even after you clear your ADC examinations, because actually that's when the real struggle begins. The other thing that I want you to remember for a top tip is using simple, clear language. And there are plenty of YouTube videos available online to help you go through that. The most important thing that I want to tell you today is do not overlook the ADC code of conduct or the professional competencies, which are so very important for you to understand what they look for when they take these examinations. So I hope this entire video on the OSCEs has been helpful to you. Of course, nothing is ever going to be enough, and you'll always have that iota of doubt. Is this enough? Do I need to do more? If you want any more information on our OSCE sessions, reach out to us and we are happy to give you a demonstration as well. I hope this video helps you navigate through your OSCEs journey, and I hope you end up with the success that you really deserve. Thank you for watching.